you mentioned, COVID has been here for 18 months. It has pushed people to think differently about their care, about not getting it, about vaccinations, so on and so forth. So what do you see as the overarching landscape for how we juggle all of these things? There's cancer, there's COVID, there's diabetes, there's heart disease, there's obesity. So, and that's probably a big question, but how do you see us moving forward to manage all of these things?
Well, I think the first adjustment, as I alluded to before, is getting used to the idea that COVID's going to be with us for the long term. I used to make predictions about when it was going to end. I remember being very excited about 2022, and then we got Delta. And so COVID, while the world is relatively unvaccinated, COVID is going to continue to circulate. And so I think the first piece is getting used to the mitigation measures, like I mentioned, masking, social distancing, hand washing, limiting time indoors and enclosed spaces and large groups. But then the other, I think, consequence of the outdoors, for example, being healthier than indoors for COVID. And I actually heard this on a call this morning with the Rockefeller Foundation's push around vaccination in the African American community here in Oakland, that some folks are particularly those who don't want to get vaccinated, are actually changing their lifestyles to be more healthy. And I think it's a novel advantage to leverage, a novel change I think we can leverage, right? To keep encouraging people to try to stay as healthy as they can through eating fresh fruits and vegetables, cutting down consumption of red meats and sugars and carbohydrates. And then the other thing is being outdoors, as I started to say, going for walks, doing more activities that are outdoors because you want to see people. And that's a relatively safe way to see your friends. So those adjustments, I don't think are going to go away because COVID's not going away anytime soon. So some of that actually addresses your cardiovascular risk reduction, especially walking and cutting down carbohydrates can really reduce obesity, which can really reduce diabetes, which also can reduce high blood pressure. And all of that is also cardiovascular risk reduction. It's actually cancer risk reduction as well. So I think we need to try to leverage those things as we move on, but also in the process, really, as I said, start to infuse back in the idea that, okay, COVID's going to be part of what's normal. And so we have to now focus and concentrate on some of those other aspects of our health.
That is fantastic that you said that, because it brings the pieces together in such a way that I think we can connect the dots a little bit more than we did before, because it seems like everything is just one thing and they're not connected. And so now this kind of brings like a holistic perspective to it. So one of the other questions, can you say a little about the variant, the one that's hitting us now and the one that was here before?
Well, right now we're dealing with Delta. The one before that was B1351, the one that they used to call the South African variant, or so that it was predominant in South Africa. That was the one that everybody was afraid of. What is it? What a variant is a slight modification of the original virus. And the reason that it happens is because every time the virus remakes itself or replicates or duplicates itself, which is what an infection is, right? It's forcing your body to make more viral particles. Every time new virus is made, some mistakes can be made in the DNA, which is the genetic material. And I like to describe DNA as being like a zipper. You have two halves of the zipper and they sort of fit together perfectly. And you know, when you have one little problem on one of those teeth of your zipper, you really can't zip it up because they don't go together anymore. They don't match. So DNA has two sides, and it fits together like a zipper. And so with a variant, what you get is almost like a broken tooth on the zipper. Suddenly that DNA is different. And that DNA, because it is the instruction sheet for the proteins, like the actual shape of the virus, the shape of those spikes that you see on the outside, the virus can behave differently. So with the Delta variant, what we're observing is that it is, number one, it is susceptible to the vaccines. The vaccines work well against Delta. But there is something about the changes in the DNA of Delta that force your own cells, once Delta unlocks the door with its spike protein key and gets in there and turns your cells into a factory for making virus. Delta is really good at making your factory overproduce. And that's why it's so infectious, because your body is now producing, compared to the last variant, producing about 1,000 times more particles. So as you're speaking and you're breathing, these particles are expelled in massive numbers. And that's why, on average, one person with the old, what we call the wild type variant, that's our native California coronavirus, was one person would infect 2 to 3 people on average. With Delta, one person infects 6 to 8 people on average. And that's because of all of the viral particles that are being produced. And that's the mutation or the variation in Delta's DNA. That's the superpower that was conferred by that mutation. And so the concern, of course, is a mutation that causes a variant that can escape from the vaccine.
Mm-hmm.
So far, there's been one that has been described, but it was first, I think it was first described in June of this year, and it never really took off. And that's because Delta was better at infecting people. So mu, which is the one that people were concerned would escape from the vaccine, has not really taken off. And the fact that it hasn't taken off since, for several months suggests that it doesn't have the right superpower in order to become the dominant variant. Delta has a superpower, which is that it forces your body to make a lot of virus so it can infect a lot of people. We don't know what the next one will be, but where do variants come from? Remember, I said that variants are viruses that have a mutation or a mistake in how the DNA has been reproduced. So the next variant is going to come from places where there were a lot of people who are unvaccinated and high rates of COVID and COVID transmission. Because the more people that are making virus in their bodies, the more opportunities there are for mistakes. And the more opportunities there are for one of those mistakes to confer a superpower, going to have us back in the upswing of a spike like we just came out of over the summer.
Oh my goodness, that is a lot to think about. So as we make our way to, because we're getting ready to go into October and we're getting ready to go into flu and so on and so forth, what would you advise people who are living with cancer and or cancer survivors? What, besides the mitigating measures you're talking about, what else could they be doing? Should they also get the flu shot? Any other things that we really haven't heard? Because I know some of the individuals we've been talking to, they are, like you say, they haven't really been going to the doctor. So I'm trying to get as much information I can for those folks.
Yeah, so the real concern, the summer was pretty bad. The rate of infections shot up, not like a gradual mountain climb, but more like a roller coaster that you're scared right away, right? Just went straight up. So the concern is, and that happened during the summer when we're spending a lot of time outside, right? Which I said is like the COVID safest. When winter rolls around and fall rolls around and it gets cold, people come indoors and they begin to congregate indoors. And so I think that we need to be very conscientious about the potential for spreading COVID at family gatherings, right? Because we're in a low point now. People are going to feel comfortable about coming together. So people should continue with the mitigation measures, but I really want to endorse vaccination for this coming season. And now is the time to get vaccinated, actually, because the basin of virus in California is the lowest of any state. And what that means is if you're vaccinating when the virus is low, it effectively freezes the virus out of the community. So now's the time to do that. As far as the flu shot, absolutely. People should be getting a flu shot, especially if you are a cancer survivor, especially if you are in active treatment, for the reasons that we've talked about already. But the second reason is that when the cases of COVID go up, and we've seen this across the country, we've seen it in Idaho, we've now seen it in Alaska, when the hospitals fill up with people with COVID, you will not be able to get into the hospital with the flu. And that means if you needed hospital care, which might be the case given an immune compromised state and having the flu, you may not get a bed. There may not be resources to take care of the flu because people with COVID are critically ill and can take up a lot of the real estate inside the hospital. So I absolutely recommend that people get a flu shot. And I really want to endorse the idea of getting vaccinated now while the risk of getting COVID is relatively low. But other than that, the mitigation measures are really where it's at, and especially avoiding during this holiday season, large family gatherings indoors, especially in mixed vaccinated and unvaccinated company.
Okay, that is good advice. Moving on to another question. So, have you seen or have you heard of any studies where breast cancer patients have experienced more side effects than, say, someone else who doesn't have cancer? So I think what the question is getting at is if someone is probably a breast cancer patient and they're actively undergoing treatment, and they say, and their healthcare provider says, you should go ahead and get vaccinated. And then they get vaccinated. Are their side effects different from the side effects of someone else? And if so, what would they be roughly?
Mm-hmm. So the answer to that is yes and no. Side effects are a function of your immune system responding to your cell's production of just the spike protein. So we are not injecting people with live virus or half dead virus or even a piece of the virus. Instead, we're giving an injection of the instructions on how to make a spike protein. And these instructions didn't come from a virus; they were made in a laboratory. And so the side effects that people get, which can range from pain in the arm, which is the most common, to headache, fever, chills, GI upset, really feeling like you have COVID, that all depends on your body's immune response to the vaccine. So The reason why it's yes, it will be different is because you're a different person than everyone else. And the reason why it's no is because you may actually have no side effects at all. So we do, when we consent people to get the vaccine, we do list out all of those potential side effects. And just from my days of being a surgeon, I really recognize that it helps people to understand and anticipate how you might feel later. So if you don't feel that way, great. But if you've been told, then you won't be freaked out that something's going wrong. So we always give the full list, but then we say, you may not have any of these symptoms at all. The most common one is pain in the arm. A rare one that may impact, as I think about the lymphatic drainage, the lymph nodes of the breast, some of them are under the arm. And you can, on the site of the injection, get a little bit of swelling in the lymph nodes under the arm. I imagine that might be distressing for somebody who has had breast cancer, if they still have those lymph nodes, if they haven't been removed. So that's something I would specifically talk to someone with breast cancer about. If they've had their lymph nodes removed under one arm or another, I would actually recommend that the shot go in the opposite arm.